already done my assessment on the patient. He has coarse bronchi, and we're going to be performing an open catheter suctioning process to help alleviate some of that mucus plugging in his lungs, and that'll help alleviate him and make him feel better and clear out the airways. So we're going to go in now. Hi, I'm Brandon. I'm with Respiratory Therapy. One of their students. I'm here performing a open suctioning procedure for your trach. Alright. We get started by putting down our sterile gloves and opening up the sterile field. We're going to then get the sterile field to stay open. And we're going to take the suction catheter and opening it up onto our sterile field. That is safe. Files and everything have been established. Now we're going to put on the gloves. We're going to be taking a minute to get on the gloves. Because efficiency matters. We're going to be having my left hand as my sterile hand and my right as my dirty. So we're going to take suction catheter, wrap it around my hand. We're going to come up here and take off his connection from the ventilator. And actually, first, oxygen is already turned on for our hyperoxygenating through a bag valve mask connection port. Suctioning has been turned on to 120 to 150. We're going to test it first. Okay, it's good. We're going to unattach him here. We're going to hook this bag up and hyperoxygenate him for 1 minute.
I got it. Normally that wouldn't happen.
Alright, we're going to disconnect this now. Plug in our suctioning ravelet. I'm going to insert this for a total of 15 seconds.
It's okay, you got it. That's all I'm
Okay. Now I'm going to cover the suctioning and pull it out, tap it rapidly, get out that mucus. Okay. Take that and wrap it around my sterile hand. We're going to hook this back up and hyperoxygenate again for a full minute. Alright, it's been a full minute again. We're going to disconnect that. We're going to suction again for a total of 15 seconds. Okay, and I feel some resistance and he's coughing. I'm going to tap this rapidly as I pull out. Alright, we got that all taken care of. You can take this off and we're going to hyperoxygenate him one more time before connecting him back to his ventilator. We're going to put okay, it's been a full minute. Alright, we're going to connect him back to his ventilator. And we are going to flush out the suctioning here. discard the used suction catheter. We're gonna go like that and clean that out. Put that down and turn that off. It was being used at a pressure between 120 and 150. Before I go, I'm going to listen to lung sounds to see if they've improved from treatment.
Verify my doctor's orders, and we're going to go ahead and do blood care on Mr. Johnson. He's improved, so we're going to do that. Hi, Mr. Johnson. I need you to Isabella. Respiratory issues. What kind of people are you? So,
All right, everything sounds more clear, and that monkey's starting to go away. I'll be back in a little bit to check on you. If you need anything in the meantime, please let me know.